16-year-old female presents with acne vulgaris over her face, back, and chest. Which one of the following pieces of advice is not correct? So avoid the mini pill. Progesterone-only pills increase the risk of having acne. So yes, that's correct. Avoid heavy makeup. Yes, especially if it's 괊ᴇʟᴇؑ, because that would increase the risk of having, acne. Avoid picking and squeezing the spots. Yes, because that would make them scar, and also you might spread, the acne if you pick and squeeze them. Avoid humid conditions. Yes, because that increases your sweating, and that can increase, the trapping of the bacteria, and then you can increase your acne. Avoid poor hygiene. Not really, because if she over showers and over cleanses, then that would increase the risk of developing acne. It's not good for your skin. It becomes dry and irritated. So avoid poor hygiene would be the incorrect one. It's not like you're promoting poor hygiene, but it's just the fact that you're not telling them to go and excessively wash their face, back, and chest, or wherever the acne is. So myth about acne: it's not caused by poor hygiene. In fact, excessive washing can make it worse. It's not caused by stress. It's not contagious. It's not cured by drinking lots of water, and it's not helped by sunbathing. But things that can make it worse, the progesterone-only pill, hormonal changes around the monthly period, thick or greasy makeup, picking and squeezing it because it can lead to further inflammation and scarring, sweating heavily in humid conditions can make it worse, tight clothing, and certain drugs like phenytoin, steroid creams, anabolic steroids. With regards to treatment, first line would be topical if it's mild or moderate, benzoyl peroxide, or with plus or minus antibiotics, plus or minus retinoids as well. Oral antibiotics, erythromycin or tetracycline. The oral contraceptive pill, because it's mixed, the combined one only, because it helps regulate your hormones. But progesterone only is not great. Isoretinoin if it's severe, but usually that's prescribed by a dermatologist because it has a lot of side effects. Okay, next one, you have a 25-year-old male bodybuilder who admits to using anabolic steroids, complains of disfiguring dome-shaped tender nodules over his face, back, chest, and shoulders, which increase in size, then break down to discharge pus, and then subsequently fuse to form unusual shapes of several centimeters. Which one of the following is the most likely diagnosis? So this is what it looks like, and it looks like acne conglobata, because they usually have that feature of becoming disfigured. They form this disfiguring dome shape, and they can fuse after they discharge pus. So acne conglobata and acne fluminans, they can be induced by steroids as well, and he's been using steroids. Acne conglobata is uncommon, a severe form of acne. They have burrowing and interconnecting abscesses and irregular scars, often producing pronounced disfigurement. And they usually come in groups of 2 or 3 comedones that become one, and it contains foul-smelling, cerebellar material that returns after drainage. So, and the nodules can be in the chest, the shoulders, the back, the buttocks, the upper thigh, arms, thighs, and the face. And it can be associated with hidradenitis suppurativa. Okay, the next question was a 25-year-old pregnant woman who presents with moderate acne vulgaris that seems to have been exacerbated by her pregnancy. Which one of the following would be the most appropriate treatment? So retinoids, you don't want to give in patients who are pregnant, even if it's topical, just because they are teratogenic. And we did speak about benzoyl peroxide being really good. It's anti-inflammatory, will help bring all the swelling down, and that's usually first line, even if they're not pregnant. So that would be our choice for now. Steroids are a no-go, just in general with acne. They're not first line in treatment at all, and she's pregnant. And isoretinoin, again, with very teratogenic, so that would be definitely not an option. And tetracycline, also teratogenic. So in this case, benzoyl peroxide seems to be the only one that checks out. So it's the safest choice. Retinoids are teratogenic. Tetracyclines can stain the teeth of the fetus, and they can also affect the liver and the kidneys. Topical steroids, no benefit in treatment of acne. It's common in puberty, associated with androgen-driven increase in sebum protection. We spoke about the risk factors and the myth and the treatment. Okay, so next one was a 35-year-old female with celiac disease who presents with intensely itchy blisters over her elbows, scalps, shoulders, and ankles. Which one of the following is the most likely diagnosis? Patient with celiac disease, they're more likely to develop dermatitis herpetiformis, so that would be the correct answer in this case. It's itchy, it's usually over the elbows. It can also go on the scalp, shoulder, and ankles, and that's strongly associated with celiac disease. Usually around the age of 30 to 40, and it responds to dapsone and sometimes a gluten-free diet. Okay, next you have a 55-year-old female who complains of developing multiple, gradually enlarging, raised brown lesions on her torso. One of these was biopsied, and histology showed that the lesions are a localized proliferation of the basal layer of the epidermis. Which of the following is the most likely diagnosis? So when there's basal layer proliferation, then it's seborrheic keratosis. So that's what would make this likely answer, because of the basal layer proliferation. So seborrheic keratosis, most common being a benign tumor in older individuals. And they have a variety of clinical appearances, from flat, raised, or pedunculated. They vary in color, can be yellow, can be dark brown, and they're usually on the trunk. And there's an increased incidence from 40 years old and older. So in this case, she's 55, and it's on her trunk, and it's brown. Histology will reveal that these lesions are a localized proliferation of the basal layer of the epidermis, and often there's also hyperkeratosis in the surface crypts. These lesions may be known as basal cell papillomas because of their cells of origin, but they're not neoplastic. They're not related to basal cell cancer. You can't find basal cell cancer elsewhere, and treatment is rarely necessary. If required, you can do cryotherapy.